Hi, everyone. This is E. David Crawford from the University of California in San Diego. Dr. Neil Baum is a frequent contributor to Grand Rounds in Urology and is a nationally recognized urologist, author, and speaker with over 4 decades of experience in medical practice management. He's known for helping physicians enhance their practice and patient care. Neil, with two co-authors, just published a fantastic book, and we're showing in here, Prostate Cancer, Expert Advice for Helping Your Loved One. Neil, congratulations on another milestone. You just have one after another, and thanks for sharing the time with us. Let me just ask you a couple questions. What is the book about? Why did you write it? And why should urologists and patients take a look at it?
Well, it's been my experience and also Dr. Mobley that the partners of patients with prostate cancer are often in the dark and have little knowledge about prostate cancer. The man with newly diagnosed prostate cancer returns from his visit to the urologist, and the partner asks, "Well, what did the doctor say about your condition, and what do they plan to do?" And you'll find that the doctor is almost like deer in the headlights. They're not able to answer. This creates a lot of anxiety. Home with the diagnosis of cancer, it creates discord and tension in the relationship. And for the most part, physicians, urologists, oncologists, they can't unravel this. They don't have the time for this.
Okay, so this book is sort of flows in a number of different chapters. And what do you think some of the real take-home messages are that help men and their families with the book?
Well, we found that the partners that read this also read it with the man with prostate cancer, because we have avoided medical jargon and we have made it easy for them to understand. Each chapter begins a vignette about what the topic of the chapter, and then we go into the details, such as versus what's the other watch versus active surveillance. That's it.
Yeah.
And then we go through a man that is confronted with that decision. And at the end of the chapter, we tell what the man decided and what happened. And then we include questions, suggested questions for the man and the partner to discuss with their urologist or oncologist on their next. We also included a psychiatrist, Dr. Garrett Key from the University of Texas, and he offers advice regarding the mental and emotional aspects of prostate cancer. And there's even a chapter, needless to say, it's at the end, on planning for dying, something that isn't usually discussed with the urologist or the oncologist.
Well, this is a really nicely laid out book, and I've actually looked at it a couple of times and had patients use it. One of the things, you're ahead of your time all the time, really. That one of the things that we could discuss at a recent meeting was that we all talk about physician burnout, but we don't really talk about caregiver burnout. We don't talk about some of the other things that happen with the wife or the significant other here. And it's real, and I really recognize that, and you and applaud that you guys got this out right away. And this is such a dynamic field that you're up to date on it. It changes daily. The stuff with PSMA, and recently some things coming out about new approvals earlier in the disease with some things. Are you planning on updating this soon, or what are your thoughts?
Yes, Dr. Mobley and I have approached Johns Hopkins Press about a revision, and probably within the year or the next 18 months, we're going to go into newer diagnostic tests that are available to tell the magnitude of the problem, and then also the new treatment modalities, new energy sources that are used for treating prostate cancer. So the person that reads this has all the options laid out to them, and they can be a better patient and participate in shared decision-making with their partner and with their doctors.
Great, Neil. One last thing. Is this available Amazon? Do you just Google Johns Hopkins Press? How do you get the book?
Amazon.com.
Okay. And that's what I've told a number of patients to do. It really, the feedback I get from it is very good. Neil, thanks for your time, and we're looking forward to talking to you soon about this and other topics.
Thank you, David.